Thank you for having me, everybody. I am the Integrated Service Coordinator here at Kapiolani Medical Center for Women and Children. And we're going to just share about what we do, a couple of different objectives we're going to fulfill. But before we do that, I really want to take this time to just practice what we do. And one of the things we do is actually meditation guided imagery. So before we kind of continue with the presentation, I want everybody to just be comfortable in their seats. Maybe turn down the lights. I have some nice music playing, if everybody can hear it. And I'm going to take you through a little relaxation meditation for your whole body, okay? 2 feet on the ground, back up against the chair. You may close your eyes if you want to, and just listen to my voice, okay? So be comfortable in your chair. If you're sitting in a chair, sit up straight and just open that heart. Let go of your busy thoughts. You will find your essence. Observe your breathing. Take 3 nice deep breaths and feel very comfortable. Inhale through your nose and exhale through your mouth. With each breath, let go of your busy thoughts. Breathe in and breathe out. Make a mental scan of your body. Notice any tension areas. Go back to any tension areas and allow it to melt away like melting ice. Relax the top of your head and scalp. Feel the skin of your forehead. Relax this with your temples. Move through your face and soften your jaw. Even let your ears, your nose, your chin, teeth, tongue, and gums relax. Feel all and go lower. Let peace flow down your neck, soothing your throat, and glide to your shoulders, upper arms, forearms, wrists, and hands. Your fingers tingle with the release. Going to your torso, feel your chest relax, giving your heart more room to expand, to give and receive love. Soften your belly muscles and allow for deeper release of tension. Feel the loving energy wrap around your back and how it peacefully softens all the back muscles as you breathe in deep, fluid breaths. Visualize happiness, harmony, and breathe out anything that does not serve you well. Relax your hips, buttocks, and then flow down to your knees, calves, ankles, and feet. Flow any remaining tension to your toes, leaving your whole body feeling very comfortable, peaceful, and relaxed. Take 3 deep breaths. Inhale through your nose and exhale through your mouth. Enjoy the feeling of calm relaxation. Know that you can come to this place whenever you want. When you are ready, blink your eyes open and be present. Okay. Great. I hope everybody's slowly coming out of that. Now we're all calm and open and can learn more things now, right? Okay, let's next slide if possible, Summer. Okay, so we're going to look at the 3 objectives here for today. And we're going to talk about integrated care, the National Integrated Care Standards and Practices, and integrated services here at Kapi'olani Medical Center for Women and Children. Next slide. What I like to kind of describe integrated as, this was a really great quote from one of the organizations that really help promote more of that integrated complementary care. And it states, integrated healthcare often brings conventional and complementary approaches together in a coordinated way. It emphasizes holistic, patient-focused approach to healthcare and wellness, often including mental, emotional, functional, spiritual, social, and community aspects, and treating the whole person rather than one organ system. And then we can move to the next. Yep. So what is integrated care? I like to start off with defining integrated with complementary care versus alternative. Complementary is more of a holistic balance, right? It creates wellness versus disease. It's healing versus curing. And it balances of mind, body, and spirit. Okay, so complementary. Alternative is used in place of conventional medicine. Okay, it's also used in place of complementary medicine. If used purely, a patient would not be admitted into a medical center if they just go with alternative. I say this because there's a lot of, sometimes I notice some of the residents say, share a lot of things such as, oh, alternative care. And yeah, it is, but it's more of a complementary service that we do here at Kapi'olani. We work with the conventional side, the medical side, very much as a team. Integrated does that. It works together, right? So that's a really big, wanted to just kind of share that. The research and evidence base that we do for all of the services here at the hospital, including the different modalities, come from the National Institutes of Health. It's very popular with individuals who want holistic modalities to promote self-care. With integrative care, there's no negative effects or side effects. So certain like drugs may bring some side effects. A lot of all the modalities we use here at the hospital are very much for the patient or family member to use as much as they need. And the great thing is that they can use it for themselves versus needing something else to do. So they have their own, they're in control of their own integrative care, right? And we've noticed also too, there's an increased number of integrative care programs in the hospital. So I know for the state of Hawaii, I know we have one here at Kapi'olani, and I know of one in the Queens Medical Center also. And there are certain parts with our affiliates of Straub and Pali that has some modalities that we do, that they do also for their services for the patients. There's other also great medical centers that have programs such as the Scripps Integrative Medical Center in San Diego as an example. University of Arizona does one. Mayo Clinics, Duke, Harvard, MD Anderson has I believe they have a great Healing Touch program. UCLA, George Washington, and University of Hawaii. So it's growing out there. And the next. Oh. Can we go back one? Yeah, sorry.
Sorry, did I go up too far ahead?
Yeah, no, just one back.
Okay.
Yeah, thank you. Yeah, there you go.
Okay.
Yeah. So the role in healthcare, what is its role? Anyone can participate when we offer these services for our patients and families. It's a great tool for pain management, not only pain management, but also anxiety levels, especially for the patients that, coming to the hospital, different scenery, different feelings, different environment, brings a lot of anxiety, stress, and this helps them, patients, to kind of calm down more relaxation, and they really enjoy it, actually. There's also been shown that there's a possible decrease in narcotic use when using integrative medicine also services. And it's a tool for use upon discharge that supports self and preventative care. So once they get discharged, once a patient comes in, I like to develop like what I call a self-care toolbox. So I teach them different services, such as, and we'll go over this, aromatherapy is one, if they're into the oils. We do TFT, we teach meditation like we just did. Guided imagery is another thing. So many different modalities that we can share with the patients. And the great thing is no negative effects or risk of overdose of integrative modalities, right? So if we teach somebody TFT, if anybody knows of TFT, it's a tapping mechanism, right? Similar to acupuncture, but without needles. You can't tap yourself to death, right? So it's actually helps them whenever they can use it. It gives them the control so that they're able to help guide themselves to bring down more of that relaxed feeling for them. And also too, we found that in some research, it did reduce some medical care costs and hospital length of stay. Next. Yeah. The National Healthcare Standard and Practices. In January 2018, the Joint Commission Accreditation Organization actually shared that they announced the implementation of new and a revised pain assessment and management standard. The requirement for this was to include non-pharmacological standards to address pain assessment and management. The three things that they kind of put down as examples, the three main ones was osteopathic manipulation, acupuncture therapy, and also massage therapy. There is also other modalities such as biofield energy therapies, which we'll go over, and even aromatherapy that can be used and encouraged to use paired with conventional medicine to use for pain management. So that was a huge support for the services for the patients. There also another organization that kind of helps with our complementary and integrative health is the National Center for Complementary and Integrative Health, or NCCIH. And the studies show what they did was over a third of adults over 18 years old use the complementary care. And in 2007, approximately 1 in 9 children used some type of complementary measures during the past year. So it's been grown since 2007. And it's used, now we have it in hospitals, now we have it in some clinics, so it's grown a lot. Okay. You can go to the next slide, Summer. So we'll start with the integrated care at Kapiolani Medical Center. We can go next. And the services offered to our patients and families are as follows. With our integrated services, and I'll tell you a little history on it. Integrated services started back in 2002, and it was started by Joyce Wong, who is an oncology nurse, pediatric oncology nurse. And she started this because she went through her own journey with cancer also, and found that while she was receiving treatment, she actually asked to have them do healing touch. And healing touch shared with her that how her body healed so much faster with it. It made her relax. And with relaxation, she was able to eat better. And she truly believed in the work. And it's here where she thought back at Kapiolani, we should do a program. And so she did the groundwork here. She laid the slates out, the rocks out, and everything for this program, and developed it into a whole service department. So really, healing touch is the foundational work here of our services. And we do have healing touch volunteers that help me out also to see all the patients and even family members if they need to. So so healing touch is the foundational work, and it's basically a biofield therapy, which uses gentle hand techniques to help to promote relaxation. It was started actually by a nurse, Janet Menken, and she developed a process, nursing process approach to develop this service, showing that with relaxation helps the body actually heal faster. So, and being relaxed, you're able to sleep better. That means you can eat better and overall feeling better, right? Reiki is also a biofield therapy, and that is actually very similar. It's energy work that's used across on the body to help for relaxation. It's based in Japan, and they use symbols for each areas of the energies, part of the energy with the body, so that the energy can flow correctly. So those are our biofield therapies. Aromatherapy is our next modality that we use. And with aromatherapy, we use essential oils, which are used to promote wellness through smelling. Okay, and we'll go over those scents that we use here in Kapiolani later. Antepartum massage. Now, we did a project, our research evidence-based project, when we started to bring this service up to our antepartum moms. And it was actually 3 pediatric nurses that wanted to do maternity for our project. And it started maybe 4 years ago, and it's going strong. And we provide massage for our antepartum mommies, which are the high-risk moms with pregnancy. And it helps with anxiety and pain also for them. We recently also have included oncology massage, which we provide for our WAC women, which is the Women's Cancer Center, and also just started our inpatient oncology, pediatric oncology inpatient. And these are the kiddos that are in for treatments, and you'll be surprised, they love their massages. Beneficial for them, beneficial for anxiety again, and pain. With the use of healing touch. A lot of our oncology kids are very open to it. They are really the highest requests that we have, including our women's too, to come and just, you know, wanting to have healing touch, wanting to have massage, be part of this for their treatment here. And also the next one is thought field therapy, which I like to call TFT or tapping. And this is what we call acupuncture without needles. So basically with TFT, it balances the body's energy fields. And this is where patients can practice on their own and build their own self-care toolkit for themselves. And we'll go over that too. Breathing meditation and simple yoga are another modalities that we use, that we teach. You'd be surprised, a lot of our patients that come in, and even families, really enjoy this. Deep breathing with aromatherapy does amazing work when we have our post-op kids. You know, we always want them to start moving after. And with the deep breathing, they actually start earlier, and we work with PT, OT, even speech on different things that we provide for our pediatrics and women's too. Infant massage, preterm infant massage. We do have a NICU here, a neonatal intensive care unit. We have a lot of preemies. We also do massage for them too. And this, we work with our PT there's a certain parameter that we provide the massage for them, and including with the massage, we want to teach the parents, because with parents being involved is so great for the bonding piece. And we truly believe that we see, once there's a bonding and the touch is so important, we do see, you know, better sleeping patterns, better feeding, better stooling, you know, everything, and baby grows, you know. So that's another thing we do. And lastly, we do also provide a aroma touch hand massage. Recently we had to put it on hold. It's mostly for staff actually, and we include staff because especially with COVID. Prior to COVID, we were providing support for our staff, and they loved it. You know, it gave them a little break time, a little time for self-care. Nurses are on the run all the time, and we provide these services. When COVID hit, we did have to hold off for it, but they still remember it. So slowly, you know, post-COVID, you know, we're changing a little bit here and there. We're starting to add little things back. So Aroma Touch is something that we're looking to help with our nurses in the future, soon future. Okay, and we can go to the next slide, Summer. I just wanted to show you, this is one of our Healing Touch volunteers, and this is Healing Touch she's providing for this oncology patient. So let's talk about a little bit of Healing Touch and Reiki. They're both biofield therapies, which promote relaxation, comfort, sleep. They reduce pain and anxiety, helps in aid of nausea and vomiting, and facilitates your own body's natural healing. Again, this was actually our cornerstone, yeah, for integrated services. And what I want to do is just a simple exercise, everybody. I know everybody's like, well, what does that feel like? I'm going to give you a little simple exercise, and I want everybody to just rub their hands together. Rub, 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 rub. Okay. Rub, 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 rub. Pull it apart a little bit. Okay. And I want you to feel, what do you feel in between there? Okay. Some people may feel warmth. Some people may feel tingly. Yeah. Or maybe like a pull, right? Or sometimes people may not feel it at all, and it's okay. But usually, sometimes you can feel like a sense of warmness, and that's that feel, that tangible kind of feeling of that energy, what we're talking about, which flows through us. What I wanted to share too is that every modality that we do provide for our patients and staff and families is that they're all research evidence-based. So that shows, they did a lot of studies on this, on how it helps with pain and anxiety. But each time when you do this, right, you can practice. Everybody's new to this, so practice, because each time you do this and you feel, right, you can actually feel it. Right? You play with that, you can feel it, right? Yeah. So practice that. It's a good way to self-care also. Because once you get it and you start playing around with it, you can actually put it here, deep breaths, and exhale out. Okay. It helps bring down that anxiety or stress that you may have. You can actually give healing touch to yourself also. Okay. All right, let's go to the next one, Summer. Thank you. All right, this is like our favorite one. Everybody loves aromatherapy. And it's a complementary therapy that we provide to use and support the patient's well-being and self-care. Inhaled. Now, inhaled is how we use it here in the hospital. There's many other ways for essential oils to be used. I've seen it used in diffusers. I've seen it used with base oils such as coconut oil or olive oil. Here we basically just use as an inhalation, and we have what we do is do a couple drops on a 100% cotton gauze, and we have a container for it. We have 5 different oils that we share with our patients, families, and staff. It's lavender, peppermint, spearmint, lemon, and orange. And each one serves its purpose different ways. Peppermint is really effective for being more awake. It's nice pick me up, especially when you hit that 2 o'clock, 2 p.m. or those who work nights. It's like, it's a nice pick me up. It's a nice to inhale it and exhale. Again, it's using that deep breathing to inhale through the nose and exhale through the mouth to really get the effect. Peppermint is also supportive for nausea. A lot of our oncology kids that go through their treatments, or even our women that go through treatment, request peppermint. And it helps, you know, in addition to their Zofran, maybe they're taking, or any other anti-emetic nausea medication, goes really well for them. The spearmint is actually another one for nausea too. Both are mints, so that's the key thing, mint. Mint usually helps and supports in, let's see, yeah, nausea, vomiting. It's a less potent than peppermint. Peppermint can be a little bit strong, but for those that can't handle peppermint, spearmint is a next go-to for them to use for themselves. Lavender is great for relaxation. People will use it to like for calming and soothing, reduce mental stress, decrease stress. Again, deep breathing with it is really vital. And then we have the citruses, and the citruses are lemon and orange. Lemon both help. The citruses both help in uplifting. So a lot of the times when patients are, you know, maybe a little depressed because they have to stay in their room, they're isolated because they're on contact isolation, they're not able to go outside yet, or even droplet isolation. We kind of share these different things. So lemon is a great one, and orange, and it does help. It actually helps them with uplifting for themselves, and, you know, a little pick-me-up for themselves too. Okay, we can go to our next one. All right, our next one is called TFT, or thought field therapy. And this is a really interesting one. Everybody kind of, everybody's like, what is that? That's really interesting. Anyway, it's a simple non-invasive modality that is done through tapping or light massage, activating the body's energy meridian points. So again, it's like acupuncture without the needles, okay? Its users focus on the thought field of the problem. So whether you have anxiety, you have maybe anger, and these are just different things, depression, even stress, pain. There's a certain algorithm or certain sequence that we tap in areas to help bring that down. Acupoints are tapped in algorithm based on users' goals, emotional state. So this was developed by Dr. Callahan, and a local doctor here, Dr. Sakai, Carolyn Sakai, she's a psychologist. She actually taught, she teaches TFT here on the island, and it's been used for our patients also, especially works very well with our teenage population. We have a AYA clinic, which helps young adult cancer survivors. Those with high anxiety very much helps with just bringing down the anxiety or their thoughts and emotional state. And we'll go over a simple one. I wanted to just go over a simple one with anxiety. A sequence would be tapping here right underneath the eye, and you would stay here for like 10 to 15 seconds. Okay, so everybody can try, we can try. So you can go here, you can go like this, you can go both. You want to stay at least 10 to 15 seconds here. The next area would be right underneath your armpit, right here. Again, 10 to 15 seconds. And the last area would be right under your clavicle. Let me just hit here. 10 to 15 seconds. Okay. I personally use this when I was traveling. I don't like to travel to the mainland by myself. So this really helps me. I usually like to rate it like from 0, no anxiety, to 10 being really high. I'm usually like an 8. And after I do this sequence, it comes down to like a 2. Now, granted, during the flight, I was still I could feel myself picking up the anxiety, and I would start again, right? That's how I control it. That's how a person is able to control how they're feeling with this simple sequence. So that's a way too that we help with patients, family members, even staff if they need it. Very simple. It's a self-care toolbox that we use. So we like to build this. It's very popular with our teenagers and AYA patients. Benefits for TFT, we can go to the next slide. Brings back the body into a state of balance by enhancing parasympathetic functioning. Modality can be done anywhere without the need of supplies or others. Certified practitioners are able to teach patients' families techniques. So that's what we do. We usually require a level 1 TFT certification to help. And it's usually a team of us that go in, or one of us that has it, the certification, we can go in. It increases resilience, self-help skills, and holistic wellness. So again, we're giving this opportunity for them to use it on themselves when they want to, right? It's giving them the control and wanting to help themselves. And there's no negative side effects of TFT. So again, you can't tap yourself to death or anything like that. But it does it's pretty effective once used correctly. Okay. And then you can go to the next slide, Summer. This I'm hoping you're able to see this. It might be really small, but these are the different treatments that we do for different needs of patients or families that we help. These are the different algorithms, and they really do help, yeah. So there's like phobias, rage, shame, stress, trauma, anger, anxiety. Those are all different tapping point sequences we can do. Okay, and then next slide. Thank you. With our integrated services, we are, there's no order needed for integrated services except for inpatient massages. So antepartum and our pediatric oncology massage. And I forgot also, because there's so many programs that are coming out, we just started our medical surgical pediatric massages for our patients to help with relaxation and pain. Those would be the ones inpatient to get a MD order. Everything else is pretty much a referral or consult. They can be done by medical staff, patient, or family caregiver, or they may contact me, by phone, email, or chat, or anytime for requests for services. All right, you can go. So I just wanted to show you how many integrated services from 2019. I just grabbed past one pre-COVID, and usually the request for the services itself, as you can see, it was almost 1,300 patients and family members received integrated care during just this short time. And that was our norm. I think like yearly pre-COVID was about almost 2,000 requests. I couldn't do it by myself because I do have my Healing Touch volunteers, and some of the girls that are in Child Life have helped me too. But there is a want, there's a want different services for this, and it's been very effective. So this is pre-COVID, and then post-COVID. You can go to the next one. Sorry, this is so small. The next one, yeah. So now post-COVID, this is May of 2022. Because of all the, we still were running strong. Even during COVID, we did have to hold back on providing massages because at that time we couldn't. And also we could only provide pretty much healing touch or Reiki and aromatherapy and meditation also for our patients. During this time, we had to figure out different protocols, different procedural ways of doing things, and yeah. But we still got a lot of requests, and it's slowly building up. Currently, we maybe a couple hundred now, coming up close for each month. So it's been, slowly building back with our patients and staff, and it's pretty much doing because of the COVID. We're shifting, right? We're shifting back to kind of normalcy. So we'll see how it goes, but more programs are being developed because of the request and just the needs of it too. We can go to the last one. So I wanted to share also our research and studies related to healing touch and how it really is. We do use evidence-based practice here for our services. A couple of these let's see, research studies actually Joyce Wong did during her time when she started the integrated services. So she did, I think, two on, there was one in June of 2012, integrated therapies that she did with a couple of them. And then she was also in the Journal of Oncology Nursing in January 2014. And also did cultural aspects of complementary care and traditional healing practices. That was also research too. Okay, and then that's pretty much it. Mahalo. Any questions? I think I talked a lot. Yeah.
Thank you, Fran.
Yeah.
Yes, thank you so much.
I hope that was, yeah.
That was amazing. I was
Okay.
thinking, I feel so much better already, despite being on team all by myself. And it was interesting learning so much. I didn't even honestly know the difference in the definitions. So that alone was a really big learning point for myself. We do have a question.
Sure.
I'm gonna run the post test while we do Q&A. Is that okay?
Okay.
Yes, please. So I'm probably a skeptic, but I suspect that massage therapy must be ordered because it can be billed.
Oh, right. More or less, massage. No, it's actually our services are non-billable. We're part of the package of what we do for our patients, right? And so, but it can be, from what I understand, especially with the different, I know HMSA does something, but I'm not too positive. And I know Aloha Care just started a program with, they do have massage acupuncture. Yeah. So there's those modalities that you can do, and they do have reimbursements for it, but it doesn't go necessarily with our hospital here for our services. But massage is ordered because of, especially our specialty in high-risk pregnancy. We just want to make sure that it's okay. I usually do an assessment. My background is also, I'm a licensed massage therapist. And so I kind of see that part of it where what muscles are okay, how does that, compared with person's pregnant. My background is also pregnancy massage. So it's kind of nice to have both sides where you're a registered nurse, but also an LMT. We don't do anything below. So hips and below for the pregnancies, because there are certain acupressure points. Yeah. And we want to keep baby in. So we'll just do a relaxing massage, and it's usually on the neck, shoulders, here, and even on the head, and nice on the back, but not really on the lower part. So because of that, and just knowing we look for other things in their lab work too, to make sure everything's okay, and we get an okay from the doc to the MD to make sure mom's okay to receive. I think she would really benefit from it. And also for our oncology patients too. I use those are inpatient peds usually gets. I look at their assessments and everything too, and if they don't have that parameter with certain things that we're looking for, then they will receive healing touch instead. Yeah.
Thank you. I feel like we could honestly listen to you talk forever.
Wow.
There's so many examples just from out of the hospital that I know of where patients really had so much pain or anxiety, and they didn't want to see any of us. Oh my gosh, one of them, obviously can't say his name right now, but I remember that you were pretty much the only person who was allowed to treat him in that sense, and you know, help manage the pain and anxiety and everything around it. So it's been so amazing to see over the years.
I think I think it's great too, because this position has given me that time and connection. You know, because we're still nurses doing it, but yeah, it gives you that connection of you're able to sit with them, you're able to talk with them, you're able to connect with them. And I think that's the piece too that, you know, it kind of misses out a little bit, but we're able to go there. And I think that connection brings that piece where they're more open for things, right? They're like, oh, okay, let's try to do this. But you know, we work as a team, and I think that's what I want to stress too, is that without you guys, you know, our medical staff, the docs, nurses, you know, even everybody, you know, we wouldn't be here, you know, because we're just really appreciative that it's accepted, and we're able to work with you guys. So that's really thank you.
No, I'm the one that feels really blessed. We're so spoiled here, I have to say, but I'm really glad you were able to share a little bit of what can be done on the outpatient side as well. So one more question that came in, which was if massage and other complementary and alternative options were offered prenatally, would that reduce premature births?
Yes.
Don't know any research of it at the moment, but I don't know if you know more. And then we'll go over the test questions right after that.
Yeah. Yeah. I think when we initially did our research evidence-based project on antepartum moms, we found a really great article, which is a meta-analysis, and it really based it on anxiety and pain, on how massage could really help and reduce. And it was really challenging finding something on that sense of, you know, it was like the gold, you know, piece of diamond that we found, because we're like, gosh, we can't find anything, you know, but that was really something that they did. And it was a meta-analysis on top of that. So we were really fortunate, and we found when we did it, because it was a 6-month pilot that we did upstairs, huge, just huge, like anxiety, the pain, bringing down how the moms felt, you know, and there were times when, you know, just having them share that they're so stressed out in the situation that just having us come in, and we kind of focused on that more of how the mom's doing. How is the mom doing? Because if the mom is feeling great, then that must feel the baby must be doing great too. So the moms, all the moms, and we were like, wow, they were really like no, we need this, you know. So and it showed. So after 6 months, we're so grateful. We just continued and doing the work. So now it's part of the care upstairs that we come and provide that for our antepartum moms upstairs. And we go there Mondays and Fridays. And everybody knows, you know, we work together as a team. Yeah.
That's so fantastic and so exciting. I did not know as much about the prenatal aspect of it, but I think, you know, that makes so much sense the way you're explaining it. And yeah, just amazing. Thank you again, and yeah, enjoy the rest of your day.
Thank you, everybody. Thank you, Anna. Thank you, Summer.
Absolutely.
Thanks, Fran. Thanks, Anna. Have a good day, everybody.